We are now addressing the knees moving inward compensation on your overhead squat. So for an example, if you're in your squat, arms are up overhead, you drop down, and you just notice that these knees fall inward, the first thing to do is just give yourself the mental cue to drive those suckers out. You want to use your hips to externally rotate, and if you can't hold your form after that mental note, or you're driving down, you can hold it, but as soon as you put down power to come back up, they drop back in, is a good sign you're going to want to make this a priority to correct it. So there's a couple things going on. Most likely you have very tight adductors. You have this big VMO muscle right here on the inside. A lot of stuff we use when we ride that it's common to just get tight, and it's just pulling those knees in. And we're also gonna work on your hips a little bit to help strengthen them and create that external rotation so you have the strength to actually hold yourself up in that position when you put down power. So here's what I want you to get with the foam roller. Now, you're gonna have to lay parallel on the ground with the roller. Could possibly be the most awkward foam roll visually you've ever done. Maybe it feels the most awkward too, okay? That's up to you, that's a personal thing. Now, 90 degrees, your hip and knee, and you're just gonna roll nice and slow until you find a spot that really jumps out at you. So for me, it's a little lower toward my knee. And what I like to do sometimes is even internally rotate a little bit and just kind of get closer down onto that VMO, but just make sure you're covering the whole area. And once you find a spot, you can pause and just do some knee extensions, some flexions. It's just another way to work out the muscle and help realign it. So after 1 to 2 minutes, you're gonna go to the other leg, get to the other side. Again, setting a timer is important just because you don't wanna be here all day. Now, wow, this side is way worse for me. 1 to 2 minutes, I'm gonna find my spot, do my flexions, extensions, roll nice and slow. And then we're gonna go to the hip, okay? So before we strengthen our glute med back here, we just wanna open up the front slightly through our TFL. Now, this is kind of a harder one to get to, and the foot position is really important. So you drop down. Now, you wanna literally put the front corner of your hip right here into the foam roller. So to do that, I can twist onto my side slightly and go bringing my foot up. So I'm on my right hip right now. My right foot just came off the ground. My right knee's on the ground. From here, if I drop my foot out, and externally rotate, it's gonna drive that muscle I'm trying to get in my hip into the roller. So experiment with that, roll to the side, find a good position, and just slowly move. You may not even need to raise the leg and externally rotate, or excuse me, I'm internally rotating. And because it's just a lot. It might be enough for you to just to sit on here. Again, 1 to 2 minutes before you bring it to a standing position and start the activation. All right, so up to the top. Now from here, you're gonna grab yourself either a mini loop band, or if you don't have any equipment, we can do this on the ground. I'm gonna grab my band real quick. Now, mini loop band, you can buy these for like 15 bucks online. Highly recommend them because this move right here is worth it. All right, you're gonna put this band either around your ankles or up around your knees. I think up around your knees is probably a better start when you're focused on the external rotation. So you're gonna go into a half squat, hands are up. You're gonna drive your knees out, putting tension on this band, and you should be using your hips. So you should feel it right up here. From here, you're gonna step out, keeping your toes straight. Very important because if your toes turn out, we're gonna now use your hip flexor and that TFL you just tried to release. So let's keep all the tension back here. Toes are straight. You're gonna hit your reps, walk to the left, walk to the right, stay nice and low. Now, if you don't have your band, what I would do is go on the ground and do some glute bridges. But with your glute bridge, the important thing is driving through your heels up as you push your knees out at the top. Now, when you squeeze your butt, I'm literally clenching my butt cheeks together, and you push out, you should feel the pressure in the outside of your hip. And it's just a great body weight way to address this muscle. Now, you want to stay on that consistently, and you should notice over time it gets easier to hold it out during your squats. But doing this in conjunction with your strength program and actually you holding those hips wide under load while you're squatting is going to be another way to really ingrain this into your movement. So make sure you combine it with your strength and you're going to be good to go.